All right, let's turn to 7 UpFront tonight and the push for more school-based health centers in Michigan. The last couple of years have certainly underscored the need for families to have access and easy access, but it goes beyond the pandemic. So joining us live tonight is Deb Brinson, Interim Director of the School Community Health Alliance of Michigan. Deb, we appreciate you being with us tonight.
Thanks, Linda. I appreciate having the opportunity to talk about this very important issue.
It is critical now, really, Deb. Tell us about your organization and the kind of services and school-based health care you can provide.
Yes, appreciate it. So on the school-based health centers, there are more than 300 of them across the state of Michigan. And what they are is they're actually the healthcare system going into the school and working with students and families in school, delivering both primary care services, but also mental health services. It's important that our kids and families have access to primary care services and mental health services, that they're working collaboratively together. We have a large waiting list for more centers needed across the state just because this model's been here for the last.
Well, you know, Deb, it's on all of our hearts, you know, Metro Detroit bearing that emotional scar of the shooting at Oxford High School. The kids went through it. They're still going through it even as they return to school and try to live normally. It's so hard for them. How could a school-based health center help in a case like that? And could it even have prevented a tragedy like that if there were signs of trouble there in a student?
Well, our hearts go out to Oxford. We have really very involved. One of our school-based health centers have been a part of the recovery team going in and supporting kids and families. What we do know is that kids are resilient. What we also know is that kids and families in schools really need to be supported and surrounded with caring adults, but equally important, they have access to trained counselors, therapists, behavioral staff who have been trained in trauma, who've been trained as licensed therapists to deliver these important services to kids. So that school, as well as every other school, can always more resources, particularly mental health, individuals coming in and working with kids and families. It wouldn't have prevented this tragedy, this horrible tragedy. I don't know that it would have prevented that. I don't know that any of us know that. But what it could have done, or could do, is just bring another layer of focus in and working with kids and families to pick up on those signals that that often start to emerge and we just don't see. And that's one of the things that we really have been promoting, actually for the last 5 years, is that we've been working with the state legislature to say, listen, we need trained counselors, trained therapists in schools, in addition to school counselors, in addition to school psychologists. They play incredibly important roles, but there is a very specific role about bringing in licensed mental health people. Those individuals who are only dedicated to providing that level of mental health services that families need, that often don't get access to. Our system in the state is really set up to handle really very, very serious cases of mental health crisis amongst children and adolescents. We really don't have a very in-depth system set up to support any child or any family that might be experiencing mental health issues. And what we do know is that often the primary care provider is one of those trusted individuals where a family or a child will start to say, no, I'm feeling really depressed. So one of our school-based health centers did a sports physical this past year. And when they did that sports physical, they did an assessment on the child's mental health. And that child scored very poorly. Enough immediately for that provider to say in the school-based health center, listen, I need to call and talk to your mom and dad, but more importantly, I need to get in to see somebody. And that evening, that child was hospitalized because the depression was so severe that they thought that child's life was at risk. That's the kind of resources that can come in when you have a school-based health center that have licensed mental health professionals.
Well, you know, Deb, there was a time, an old phrase that was like, you're just a kid, you're just a kid. But now these children are going through so many adult-themed issues that they have to deal with. Your organization a big help, and we appreciate you being with us tonight. Thank you so much.